My name is Dr. Victoria Handa. I'm a professor of gynecology and obstetrics here at Johns Hopkins. My area of expertise is sometimes called female pelvic medicine and reconstructive surgery, or urogynecology. And what that means is that I help women with conditions such as bladder control problems, uterine and vaginal prolapse, and other conditions that are called pelvic floor disorders. In fact, I help to lead a center for pelvic floor disorders here at Johns Hopkins, which includes specialists from a variety of different departments. The reason I went into this field is because I really saw a need to help women who come in with these types of problems. I think most of my patients realize that these problems aren't dangerous or fatal, and yet they really disrupt a woman's quality of life. I really get a lot of satisfaction after, for example, a successful surgery for prolapse, when the woman comes in and tells me that really she'd never talked to her family about the problem because it was a little bit embarrassing, and it really was disrupting her life, and she seems so happy now that the problem is solved. So that's very gratifying for me. At Hopkins, I also have an opportunity to be a teacher. I teach not only medical students, but also gynecology residents. And our center is one of about 24 in the country where fully trained gynecologists and urologists come to get additional skills and training in this area. I'm primarily at Hopkins, though, as a researcher. In my prior job, I was very frustrated when women would ask me why they have the condition, and I wasn't able to answer that question. At Hopkins, I have the opportunity to do research that's very meaningful. I have the opportunity to do research with a collaborative team of specialists, and it's because of that teamwork that our research has been successful. I hope that by identifying some of the why questions, we'll not only be able to develop more effective treatments, but we'll also be able to help prevent these conditions in the next generation of women. That's important to my patients. They ask me how I can ensure that their daughters won't have these same problems. So I hope you'll keep all this in mind and consider Hopkins for your care.